In addition to those ASA basic monitors of blood pressure, heartbeat, and all that, what you have to see is that why do you need additional monitors? And spine cases, the most important thing is blood loss. So you have to have a monitor that will help you detect hypertension early on, and get blood samples to check hemoglobin and all that. Obviously, I'm going towards arterial line. So arterial line becomes very important, and because the potential of the blood loss. Different type of, again, patients. There are basically two major group of patients that do spine surgery in pediatrics. One is the idiopathic, and one is the secondary. And the secondary ones, whether it's from cerebral palsy or some muscular diseases, tend to have more blood loss. And so you want to have more monitoring device, a decent IV access on those patients. And when I say IV access, for most of these cases, a peripheral IV, a couple of decent peripheral IVs, I'm talking about 18 or 16 gauge IVs, should be sufficient.
And in what type of trend do you check blood gas and monitor carbon dioxide, hemoglobin, things like that? Good.
I always put, right after we put the arterial line, I would take a baseline whole blood profile. So whole blood profile will give you all the electrolytes, the gases, that's CO2 and oxygen, and hemoglobin and calcium and all that. So it gives you a baseline from which can become your reference point as you go along with the surgery. So repeating that every so often, depending on blood loss and several different factors, would be very crucial. And there is, as you know, a flow track equipment that will derive a certain data from the arterial line. Is useful mostly in adults, but as you know, those things are not licensed to be used in pediatrics, and they recommend you don't use it when they are 40 kilos or less. So that becomes less significant. So, but arterial line becomes important. Like I said, there are a certain group of patients that while central line is warranted, especially on the patients who have a muscular disease which is not limited to the skeletal muscle. There are some muscular dystrophies where there is myocardial disease in addition to skeletal muscle disease, and with their scoliosis comes some form of heart disease. And those patients, you want to monitor them more intensely than central line becomes important. But like I say, most of them, a peripheral line with an arterial line should be sufficient.